Welcome to Adapting Class. NCLEX prioritization is something that you have to master for your NCLEX. As usual, the NCLEX love asking questions on them. And therefore, these 10 questions are designed to teach you how to prioritize test-taking strategy with delegation. Let's get to it as we conquer these prioritization questions. This is the first question. As usual, I'm going to show you how I do my prioritization. It's straightforward. If you need more, check Adapting Class. There's a bunch of videos. I call it B.E.S.H.A.R.P, right? It means you have to worry about a breathing issue. The E, you have to worry about electrolyte. The S, you have to worry about shock and sepsis. H, you have to worry about hypoglycemia, hypothermia. A is the airway issue, right? And then P is pain, right? And there's R, we talk about latitude, which is neurological problem. It doesn't mean you should follow the order that B is number one. It means you have 1 second. If you have 1 second, what are you going to do? Which patient would you see if you have 1 second? That's all. That's all what prioritization means. All of them have problem, but whose problem is more important, right? 4 patients. Which client the nurse should call first? A nurse at the Women's Health Clinic is reviewing telephone message from the client. 30 weeks, they all have 30 weeks, right? The way I do prioritization is I look at a case and I said, okay, what do I have? 30 weeks pregnant, right? G1, P1, P0, all of them first pregnancy. One report severe itching of the hands and feet and worse at night. Then 2, the same thing, 30 weeks, G1, report increased test and urination. Number 3, the same 30 weeks, G1, P0, blood pressure of what? 130/70, and the leg edema. And then the next one, G1, P0, report a temperature of what? 101, 24 hours after influenza vaccination. These are 4 patients that you have to prioritize, right? And so this is blood pressure. These are 4 patients you want to prioritize. Whose problem is more important? If you have 1 second, you got to be shocked. That means, is there any breathing issue, electrolyte, shock, sepsis, airway? And then if they have pain, is the pain is going to kill them? Then the way you're supposed to do is to divide the case into 2. Don't worry about the way they've given you the information. Divide it into 2. What is the problem? G1, what is he complaining about? Hands and feet, itchy at night. Same thing. This patient, test and urination. Is that what is expected in a pregnancy? Is that concern you? Blood pressure of 130/70 and the leg edema. And this patient has fever after influenza, what? Vaccination. Always look at the cause and effect. There's a cause and effect. That's how you try to be sharp when you do that, right? Cause and effect. Why is your temperature is 101? Because you had influenza vaccination. Your blood pressure is 130/70 and you have leg edema. You're pregnant, right? You have increased test and urination. You're pregnant. You have severe itching of your hands and feet, but this is happening in the evening. Where's that in the evening? If you know the answer, you can put it in the comment. But let me know, 10 seconds, what do you think? Which patient we should see first? Put your answer in the comment and tell me who you want to see first. Prioritization 101. Look, 30 weeks old, pregnant, with their hands and feet, that is itchy at night. That's a bad problem. 30 weeks old with increased taste and urination, that is an expected finding in pregnancy. 30 weeks old whose blood pressure is 130/70 and leg edema. Leg edema is expected in pregnancy. It's not a problem. 30 weeks old, you report fever of 101.101 after what? Vaccination. If I give you a vaccine, you're going to have fever. You're going to have arthralgia. You feel like you're getting sick. That is an expected finding. Based on that, you have to go. You don't get tracked with the normies. The fever here is not important. You get influenza vaccination. That's fine. This blood pressure is not that bad. The leg edema, of course, that's what you expect. This is not pre-eclampsia. If you're pregnant, you're going to have increased stage, you're going to urinate all the time. That's not a problem. The worst one is this: severe itching, hands and feet. This is maternity prioritization 101. Maternity prioritization 101. Patients who have severe itching of the hands and feet when they're pregnant, this is what we call cholestasis of pregnancy. That's a bad problem. A bad problem. A bad problem. Don't forget it. So this is number one. That's your right answer. That is something you shouldn't forget. Number two, who should the nurse assess first? Same thing. Who are you going to assess first? The nurse is aware of what? 4 clients who present to the emergency room at the same time. Look, I said the best way to read prioritization question, divide into 2. What is the problem and what is happening? Patient has what? Femur fraction, right? His heart rate is what? 101. Is this what you expect in somebody who has a femur fraction? Somebody with a suited thin sputum after house fire and his saturation is 98%. This patient has severe ankle sprain and is reporting 9 out of 10 pain. He has right lower quadrant pain, fever, and a white count of 10. And I said, if you are being sharp, you know that these patients, some of them have pain. And then you ask yourself, is this pain going to kill you? If it's not life, limb, eyesight, don't pick it. If not life, limb, eyesight, don't pick it. You have right lower quadrant pain, fever, and white count. What is this? Appendicitis. You have severe ankle sprain. Report what? 9 out of 10. Unexpected finding. Your leg is going to hurt if you sprain your ankle, right? Suited stained sputum after house fire, its saturation is 98%. What do you think? Open femur fracture and a heart rate of 101. What do you think? If you break your femur, you're going to have tachycardia because it's going to hurt. 101 is expected, right? Shoot fire house. If you're involved in a fire, there's a smoke inhalation, CO2 inhalation. Of course, your saturation is not going to change. It's going to remain normal because of carboxyhemoglobin. Every time you see somebody involved in a fire, their saturation remain normal because of the carboxyhemoglobin. But in actual fact, they have no oxygen going on. So even though the saturation is 98, that is a trap. The fact that they have suited stained sputum, that means they have airway problem. This patient is in trouble. Number 2 is your right patient. So these are little things you should know. Which client should the nurse assess first? Same thing. Prioritization 101. You got to be sharp. Breathing, electrolyte, shock, sepsis, airway. And I'm going to show you these little things. If you do it, this prioritization become easy. If you have problem trying to figure out who you should see first, right? Emergency department nurse is assigned to triage. Who is she going to triage? The same thing, divided into 2, right? I have leg pain and edema, right? And redness. After what? I step on a nail. I have beefy red ulcer above my ankle and I have leg edema. Is this something you should worry about? I have calf pain, right? And I have swelling, right? And warmth after 12 hours of car ride. I have intermittent leg pain. That works when I'm walking and eases with rest. Guys, what do you think? If you have 1 second, you're taking care of this patient, and you have 1 second, 4 patients showed up, who will you give that second to? That's what I mean by prioritization 101, and that is the B.E.S.H.A.R.P. Do you see a breathing issue here? Do you see electrolytes? Do you see shock, sepsis, airway, and neurological problem? And if they have pain, is the pain going to kill them? If it's not, then ignore it, right? Put down your answer. Let me know. What do you think, right? Intermittent pain, when it happens, in the leg, in the calf area, when I'm walking, but then it goes away when I stop. This is claudication. Am I going to die from it? I have calf pain, another pain, but it's swollen and it's warm. Basically, the temperature is very high. And then it happened after riding a car for 12 hours. What do you think? I have an ulcer that is big and red, beefy red. That basically, this is the leg. There's an ulcer here. And then I have +3 edema. What do you think is wrong with this patient? I have leg pain, edema, and redness when I step on a nail. Look at it. This is the B.E.S.H.A.R.P 101 all over. If you have leg pain, edema, and you step on a nail, probably you have sepsis, right? That's right here. You have beefy red ulcer above your ankle and leg edema. This is a chronic venous disease, right? Calf pain, swelling, and warm 12 hours afterward, riding a car. This is DVT. And then intermittent pain when I walk, then it stop. When I rest, this is what? Claudication. Who are you going to see? A claudicant, somebody possible DVT, somebody with the sepsis, and somebody with what? Chronic venous disease. That is the only way you can master prioritization. Now you have changed this question into something manageable. You have a diagnosis. Who do you think you need to see? I have DVT, I may have sepsis, I have claudication and chronic venous disease. You know the right answer, right? The right answer is somebody who has pulmonary issue. The DVT is going to turn into pulmonary issue. Therefore, number 3 is your best answer. 3 out of 3. What did you get so far? Let me know. Put it in the comment. Delegation. You have to master it. There's so many delegation stuff you have to know. But I said, don't worry about it. There's an easy way. When they give you a question, look at who is involved. If it's a UAP, think about it that the UAP is not thinking about anything. All the attacks does not require any thinking except what? ADLs. Therefore, this is a question on a UAP. What is the problem? And then she's delegating tasks to what? To the UAP. So she's delegating tasks to the UAP. Which task is appropriate for the UAP? I told you, test taking strategy. I write my ADL and I said, no thinking, right? Anything that does not require thinking is the one I'm picking. That's all. If I have to make an assessment, if I have to do any too much thinking, I ignore it. Assisting, buzzword, I'm just helping. I'm not doing anything, right? You don't even have to read the whole question, but you should read the whole answers, but you should read it. Assisting a client with Parkinson's disease during meal. This is ADL. I'm showing you this is the easy way. That you go back to your buzzword. I'm only looking at 2 buzzwords, ADLs and no thinking. Measuring and recording intake and output. That's what I do. Does not require thinking to record it. Ambulating a post-op client for the first time. You can ambulate, but the first time you should not do that. What do you think? How about 4, 5, 6, and 7? I want to know how you're thinking. What do you think? Obtaining vitals on a client, receiving blood transfusion, providing peritoneal care to a client with an indwelling catheter, turning and repositioning a client every 2 hours, and teaching a client how to use a walker safely. What do you think? 4 and to 7. Which one do you think we can delegate safely to the UAP? Let me know. Put it in the answer choice and let's think about it. As you can see, I told you what? No thinking. Why would you have to teach a patient about anything? You have to be able to think and do that, right? Turning and repositioning does not require anything like that. And providing peritoneal care does not require anything. You're just providing care. This is a problem. I intentionally put it there. If the NCLEX give you and they don't give you time, assume that they cannot do it. They can check vitals after 15 minutes. But I said obtaining vitals on a client receiving blood transfusion. I did not tell you what time. Therefore, you assume this is maybe the early, therefore you should not assign it to them. But if I said after 15 minutes of transfusion, then the UAP should be able to do that. So what are our right answer? Assisting, number one, is fine. Measuring is fine. Ambulating is okay, but because it's first, it's not. Obtaining vitals on a client receiving blood transfusion is wrong, and teaching a client is wrong. So let me show you again. These are the one that the UAP will be able to do. You can assist a client with Parkinson's disease during meal. Okay, measure and record intake. You cannot ambulate a client for the first time. You can obtain vitals, but not when they're receiving blood transfusion and there's no time, right? You can provide perinatal care. You can tend the patient, but you cannot provide any teaching. These are answers for that particular question. 4 questions so far. Tell me your score. Number 5, a charge nurse is delegating tasks to now an experienced LPN. You have an experienced LPN. Which tasks are appropriate for the experienced LPN to perform? Select or apply. Administer a subcutaneous heparin injection to a client with DVT, completing the admission assessment for a client with a heart failure, reinforcing teaching about wound care for a client being discharged tomorrow, monitoring for signs of reaction in the client receiving blood transfusion, and developing the plan of care for a client with what? Pneumonia. Let me know what you think. Which answer choice will you pick? This is experienced LPN. It's not just an LPN, it's an experienced LPN. What do you think you will be able to do? Let me know the answer. What do you think? The trick here is experience. If you're taking the NCLEX and you see this word, experience, don't fall for it. Or they use the word student nurse. They still student. The nurse does not matter. It's a student nurse. Experience is still an LPN. So their scope of practice does not change just because they experience. And that's the key. Therefore, giving subcutaneous heparin injection is not a bad medication. Completing the admission assessment, they cannot do that, right? They can reinforce teaching. They can monitor a client signs of infection during blood transfusion, but they cannot develop plan. The easy way to remember it is MMR most. That means most medication. They can do special tests. They can provide chew feed. They can reinforce. They can monitor, and they can give most medication. And therefore, those are the functions of the LPN. And as you can see, number 1 is right? They cannot do admission assessment. They can't do that. They can reinforce the teaching on a patient who is going to be discharged. They can monitor blood transfusion, and then they cannot develop plan of care. So those are the right answers. A nurse is in a medical surgical unit is caring for 4 clients. Which client should the nurse assess first? So nowadays, they will give you a bunch of prioritization patient, and you have to answer questions about them. In the case study, I made a video about it. If you want to know, you should watch it. This is what they're asking you. They can give you a case study, and they can make it a prioritization question, and you have to answer questions about it. That means you have to know how to order the patient, who you see first, second, third, and fourth, not just who you're doing, you're seeing first. If you have to do that, if you're taking the NCLEX or LPN right now, this is the way they're asking the question. You should know about it. I made 3 videos on YouTube. You can watch it. But this is the way they will give you the question, right? These are 4 patients. A client receiving vancomycin IV will report flushing and itchy of the neck and the chest. This is not a case study, but I want you to arrange it as number 1, number 2, number 3, and number 4. And the first one is a client with heart failure prescribed what? The Jackson will report nausea and blurred vision. The client prescribed what? Metformin who is scheduled for a CT scan with the IV contrast in 8 hours. A client prescribed warfarin whose INR is 2.8. If you have to see this patient, all of them, who do you see number 1, number 2, number 3, and number 4? Let me know what you think. A digoxin patient with a heart failure patient, or somebody receiving vancomycin, somebody on warfarin, somebody who is prescribed to get what? Metformin and is getting the CT scan. Be comfortable arranging them. Don't pick number 1. If you're able to do that, that means you master prioritization. That means this is what the nurses do in a real life. And then when I saw that case study, I know that they're trying to make it a real life situation. They give you 6 patients and they ask you prioritization questions on them. That means I want to prioritize about orders and everything. 4 patients. Who do you want to see? 1, 2, 3, 4. And I can help you. Number 1, of course, ask yourself which condition you don't have second. CHF, digoxin, and what is this? Blurred vision and nausea. What do you think? Vancomycin, flushing, itching of the neck and chest. Patient is on metformin. Is going to get a CT scan 8 hours. Yes, warfarin is INI 2.8. Right. The person who does not have time is the one who is showing signs of toxicity. Right. The digoxin with the GI symptoms is a bad problem, and the vision changes. Therefore, this patient is in trouble. That's the first patient you're going to see. That patient is in trouble. That's number 1. Now, who do you think is going to be number 2? A vancomycin patient with flushing, or somebody with warfarin with the INR of 2.8, and then metformin who has CT scan. Who do you think need to go second? That requires some form of prioritization. This guy, even though it's not an allergic reaction, that is Redman syndrome, this medication need to be slowed down. So you're running out of time. So he or she will be the second patient who had the medication to be slowed down, followed by somebody who is going to get a CT scan, and we got to stop the metformin. Hold it. The INR with warfarin 2.8 is still within the range, right? 2.5, between 2 and 3, depending on what you have. So the last patient is the INR. But every time you see prioritization question, I want you to do this and arrange them 1, 2, 3, 4. So that when you see a case study and they ask you to arrange who do you want to see, you'll be able to answer these kind of questions easily. But these are little things they're trying to trick people with. But just don't only the first patient who do you see first, second, and third, and fourth. Number 7, a nurse is reviewing a list of clients on medical surgical unit. Which client should the nurse assess first? Therefore, once again, who is going to die? Who you don't have time? You have to be sharp. Whose problem is concerning? That's all. You see, I never mentioned ABC because ABC does not make you think. You want something that will make you think. And that means critical thinking of the individual patient and see what is wrong with them. If you have 1 second, try to figure out whether the effect is normal or not. Now, and then divide the case into 2. 1, aplastic anemia. You can see the way I read it. I don't read the whole question because it doesn't help me. So I find the buzzword. The buzzword is what? Aplastic anemia. What does he report? Sore throat and fever. I circle them and my eyes on them. I'm basing my eyes on them. If I see aplastic anemia and you have sore throat and fever, is it okay? That's all. I have Hodgkin lymphoma and I'm scheduled to get chemotherapy. Is that something bad? Do I have like time to deal with you? I have tuberculosis and I'm coughing some small amount of blood, thin and streak in my sputum. And I have Bell palsy and I have drooling. If you're taking care of these patients, you are aware of them, you are assigned to them, and you receive report, who are you going to see number 1? That's all. Is he the aplastic patient with the sore throat and a fever, or Hodgkin lymphoma who is getting chemotherapy, who's about to get chemotherapy? He said, begin. TB patient is coughing small amount of blood and streak sputum. or somebody with the Bell palsy who is drooling, what do you think? Go back to the B.E.S.H.A.R.P. Is there any sepsis issue? Is there any airway? Is there any breathing? And if you have pain, is the pain going to kill you, lose your life, a limb? Let's look at it. Aplastic anemia means what? That is where you bring your content and you said, my WBC is down. My platelet is down, right? My hemoglobin is down. Because of my WBC is down, I have pancytopenia. If I have fever, I'm having sepsis. Hodgkin lymphoma, he has cancer, he's scheduled for chemotherapy. There's nothing wrong with him. Nothing. He's just waiting. TB patient, well, you're going to cough. If you cough, there is some small blood in it. It's concerning, but I expect you to cough. The palsy, of course, you're going to drill. Just because you're still drilling, you're going to pick it. Understand the concept. Go back to the pathophysiology. Bell palsy patient, why would they drilling? Drilling in bell palsy patient is an expected finding because if this is their mouth, that side of the mouth is not working. So their saliva will be leaking down. Of course, it's an airway. If you don't control it, you can have airway issue. But as drilling, you expect them the saliva to just run on their mouth. But you deal with it first. Lay down, right? But at least this guy who has aplastic anemia, he has a rare problem. Bell palsy, anticipated problem. Sometimes that's another way you think about it. It's an anticipated, right? The bell palsy is supposed to drill, but if you don't deal with it later, it may have aspiration from the drilling. But aplastic anemia already have a problem. It's not anticipated. He has a sore throat and a fever. Therefore, due to low the VBC, I'm worried about him. I'm worried about him. Therefore, number one is your right patient. Okay, these are prioritization. I want you to master them. Two more questions. I want you to ace this. Okay, ace it. And next is aware of 4 assigned client. The next should first see the client with what? Who? He has AFib. See the way I'm going to read it. I have AFib. I'm on Labetalol. And I have irregular rhythm on the cardiac monitor. Should that concern you? You got to be sharp. Pneumonia. My Y count is elevated. I have crackles in my lung bases. You got to be sharp. That means breathing, electrolyte shock, sepsis, airway, and pain. I have pericarditis. My blood pressure is 140 over 119. You got to be sharp. I have a COPD and I have palpitation after you give me Abodro. What do you think? Put down your answer and explain it if you can. Why you pick 1 over 2 over 3 over 4? Why do you pick E1? Like patient has AFib, is on Labetalol, he has irregular rhythm on a cardiac monitor. Patient has pneumonia, his Y count is elevated, and he has crackles at the lung basis. Patient has pericarditis, the blood pressure is 140 over 119. And somebody with the COPD who has palpitation after we give them Abodro. If you have 1 second, who are you going to see? That's all. Who will you give your 1 second to? And let's break it down. AFib, of course, is supposed to have irregular rhythm on the cardiac monitor. I put you on a Labetalol. I'm treating you. I expect AFib to have irregular rhythm. Okay? We will control your rhythm later, but the rate is more important than the rhythm. Therefore, 1 is out. Pneumonia, where I expect your Y count to go up. You have crackles on lung base. You're going to get some fluid from the pneumonia infection. Ignore it. Just because I mentioned lung, don't pick it. Always go with the situation, not just where's that. Everybody talk about lung. This lung is not in trouble. The lung here is fine. It's just some fluid around it from pneumonia. Pericarditis, well, your blood pressure is 140 over 190. There is no pulse pressure here. The systolic is getting closer to the diastolic. That is what we call narrow pulse pressure. Our blood pressure is what? 120 over 80. You can see the difference close to 40. That is why we do that. This pressure is less than 35. It's a problem. This is what we call narrow pulse pressure. A pericarditis patient with a narrow pulse pressure, it means they have what? Cardiac tamponade from constrictive pericarditis. This patient is in trouble. COPD, I give you albuterol. Albuterol speeds things up. It's a beta agonist. Your heart rate goes up. You become jittery. You have restlessness. You may have tachycardia. Your sugar goes up. Your potassium goes low. This is constant idea. Key fact you have to know about albuterol. Well, you have palpitation. Because I give you albuterol, it's fine. Therefore, number 3 is your right answer. When you pick it, that is good. That means you're paying attention to B.E.H.A.R.P. So 3 is in trouble, and we got to see him. Same thing, same strategy, and I'm going to use the same thing. And you to do that and follow me, right? And next is reviewing telephone messages from several clients. Which client should the next call back face? Divide it into 2 and say, and ask my patient to complain of restlessness. We give him what? Beta agonist. I've already given you the content there. CHF. You report dizziness after the first dose of what? Bumetanide. Do you recognize the medication? Trigeminal neuralgia. I have shooting, shock-like facial pain. Is this what you expect in trigeminal neuralgia? I have chronic pain. I take carbamazepine, and I have sore throat. Ask yourself, what do you think? What do you think is going on? Asthma, restlessness because I give you a beta agonist. CHF, you have dizziness. Well, after the first dose of bumetanide. Trigeminal neuralgia, you have a shooting, shot-like facial pain, and a chronic back pain, you're taking carbamazepine, and you report sore throat. If you have 1 second, who do you want to see? If this is the first question, you see it on the NCLEX or the APN exams, what do you think? Or nursing school, and you give you this. What are you going to pick? If you get it wrong, it's okay. Keep charging as always. And figure out why you get distracted by the words. There's words there to distract you. And the number 1 is number 3. Trigeminal neuralgia. Well, this is your face. Okay, the nerve is here. It's like firing, like electricity. You're going to have shooting, what? Shock-like pain. It does not matter. That is classic. You're not dying from it. CHF, where I give you loop diuretic, you're going to get what? A little bit dizzy, orthostatic, if you get up, or something like that, a first dose. As you get used to it, get out slowly. Asthma patient, you get beta agonist, you're going to look restless, anxiety, palpitation, your heart rate goes up. Enjoy. But if you have chronic pain, I'll give you carbamazepine. You report sore throat, you realize that there's a content related to carbamazepine. I've been doing pharmacology series because some people, I get an email about them people having issues with pharmacology. So I have 14 videos on pharmacology. If you have a problem, you should watch that series. Every pharmacology you need to know for nursing school or NCLEX, and you see carbamazepine. Carbamazepine, what is the major side effect of it? What is the major side effect of it? It looks like clozapine, right? They all start with the C, but this is an antipsychotic. This is an anti-epileptic. But number 1 problem is what? Agranulocytosis. Sore throat and agranulocytosis are not friends. Therefore, number 4 is your right answer. We got to see this patient. He's getting into septic. And of course, you got to end with delegation, an assignment delegation, right? It's an LPN. I give you the content regarding LPN, right? And the key thing is NCLEX will trap you. I give you RN, LPN, UAP. They're going to give you a bunch of information. The key thing is this. You stay in your lane. LPN, I want you to stay in your lane. UAP, stay in your lane. Even though there's some work, LPN can do some UAP job. When the three of them are together, everybody stay in your lane. So this one, who do you give it to? LPN. Administer oral antibiotics to a client with pneumonia. Reinforcing teaching about using incentive spirometer. Performing sterile wound care on a post-op client. Assessing the client with new onset shortness to breath. Monitoring for adverse effect of IV antibiotic. Administering IV push morphine for severe pain. Collecting a urine specimen for a client with the Foley catheter. Put down your answer. Let me know what you think. What tasks do you think the LPN is allowed to do? This is the last question for the road. This is Adapting Place. Thank you for watching. This is the last question. Put down in your comment. Let me know how you think. If you have not subscribed to our channel, please subscribe and get more content like that. Adapting Place is a home of content review, mastering, making it easy as much as possible. And if you need more, you can join our membership where we have some restricted video. But a lot of videos are free. But this is one of them, free prioritization strategy to master it, because they keep on showing up and up and up. They're going to ask you. Now they're making it in the case study. Therefore, what do you think? Let's get to it. He can administer antibiotic. This antibiotic is not going to kill it's not high maintenance medication. Reinforcement is something they do all the time. They can perform dressing change. It's fine. It's a post-op patient. Assessing a client with a new onset, right? Assessment, new onset, negative. They can monitor the adverse effect of IV antibiotics since they can give it to them, right? Narcotic, especially if it's coming in the push form, they cannot do that. And of course, collecting a specimen, this is a UAP job. Should not touch the UAP job. So this is what I said from the beginning. They should not touch a UAP job. If you overselect, you get it wrong. Number 7 belongs to UAP. LPN can do it. But if all the three are together, once again, all the three are together, you stay in your lane. Collecting a urine specimen from a client with the Foley catheter belongs to a UAP. LPN should not do that. Therefore, those are your answers. Thank you for watching. Thank you for subscribing to Adapting Place, and take care of yourself. Good luck in your exams and all the best of luck. Okay, bye-bye.